So the pelvis is composed of three bones primarily. There's a hip bone on one side, a sacrum, and another hip bone. And of course it is joined by the fifth lumbar. What happens with sacroiliac problems is if this area gets stuck, there's low back pain. And what happens is these joints, which should move when you walk, become actually stuck. And so loosening those areas up helps to balance the pelvis and gives the body a strong foundation. So you might be asking, why does this sacrum move anteriorly on the right? Why does this right hip bone move forward and up? The reason is because for 7 million years, we've been throwing spears. We've been fighting with sticks, and our body is rotated so that our right hand is our dominant hand. Or if you're a lady trying to start a fire 5 million years ago, you might take some sticks and you do the same kind of thing. So the body has learned to rotate to accommodate these behaviors. So because of this, 90% of us are right-handed. And of the 10% who are left-handed, 60% of them are ambidextrous. Because our body is this way, and that's why we have the doors in a certain position. That's why we have gear shifts in a certain position. That's why we have tools designed a certain way. And so that continues this use that goes back 5 to 7 million years. So there's two ways of doing this. There's the assist and the resist. This is the resist technique, where I put my hand in a position on the pelvis, and the patient will move to accomplish the mobilization. So I put my left hand on the posterior superior iliac spine, and my right hand goes on the anterior inferior iliac spine. So when Elizabeth rolls back to my hands and then stop, I'm moving it in that direction, like a teeter-totter. Roll back to my hand and relax. That's a teeter-totter. To move it in the other direction, it's very easy. One hand goes on the anterior superior iliac spine, and the other hand goes on the ischial tuberosity. Now, Elizabeth, roll forward toward my hand, and then relax. So that moved it in this direction. So resist technique just requires you to move your hands, and the patient moves for 1 to 2 seconds, and that's all that's required. Now with the resist technique, if I want to move the pelvis forward, I say roll back toward my hand, and it goes forward. And then I say lean forward into my hand, and it goes backward. So it's forward, backward, forward, backward. So my